Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist, and happy June. New month, new CHT prep. You know what that means. We're doing 15 CHT practice questions. If you haven't been here before, this is how it's going to work. We're going to go through all 15 questions. I'll read them off for you. Take your time, answer them, pause the video as needed, and then make sure you have all of your answers ready to go, because then we're going to go back through the questions and give the correct answer and a rationale behind it. So get yourself ready and good luck. Let's go ahead and get ready for the CHT exam. Woohoo! Question 1. Boutonniere deformity in a patient with rheumatoid arthritis occurs due to synovitis, which causes destruction of which of the following structures? A. Central slip. B. Volar plate. C. Oblique retinacular ligament. D. Triangular ligament. Question 2. Which of the following describes avascular necrosis of the lunate? A. Preiser's disease. B. Kienbock's disease. C. Slack wrist. D. Perilunate dislocation. 3. The Ganser muscle is a possible compression site for which of the following nerves? A. Posterior interosseous nerve. B. Ulnar nerve. C. Sensory branch of the radial nerve. D. Anterior interosseous nerve. Question 4. A patient recently underwent ORIF of a displaced olecranon fracture after a fall on the posterior elbow. The operative report reveals that the fracture was fixated with a plate, and the surgeon noted a good quality of repair with adequate stability and no significant triceps involvement. When would you most likely begin active range of motion of the elbow for this patient? A. Start active range of motion after 2 weeks of immobilization. B. Start active range of motion 1 to 2 days following surgery. C. Start active range of motion after 4 weeks of immobilization. D. Start active range of motion 7 days after surgery. Question 5. In assessing a patient with shoulder pain, which of the following positive tests would indicate bicipital tendinitis? A. Drop arm sign. B. Neer's test. C. Jurgensen's test. D. External rotation lag sign. Question 6. In the first 2 weeks of rehabilitation following a subacromial decompression, which of the following would not be part of your treatment plan? A. Pendulum exercises. B. Use of a sling between exercises. C. Full end range of motion of active and passive range of motion. D. Gradual passive range of motion as tolerated. Question 7. A patient has a fingertip wound that will require a flap for larger coverage and to provide length to the tissues to preserve functional pinch. Which of the following flaps would be most appropriate? A. VY advancement. B. Cross finger. C. Lateral arm flap. D. Moberg advancement. Question 8. A cross-finger flap is an example of A. Pedicle flap. B. Local flap. C. Free tissue transfer. D. Skin graft. Question 9. A tight watch band may cause which of the following nerve compression syndromes? A. Guillaume's canal. B. Ulnar tunnel syndrome. C. Wartenberg syndrome. D. Pin syndrome. Question 10. Which of the following is not a potential soft tissue site of compression of the ulnar nerve? A. Deep flexor pronator aponeurosis. B. Cubital tunnel retinaculum. C. Ligament of Struthers. D. Medial intermuscular septum. Question 11. What is not true regarding the collateral ligaments at the MCP joint? A. They are taut in flexion. B. They are taut in extension. C. They are loose in extension. Or D. comprised of an accessory band and a true band. Question 12. In a VC instability pattern that occurs as an ulnar-sided lesion, which of the following is true? A. Lunate flexes. B. Triquetrum flexes. C. Capitate extends. D. Scaphoid extends. Question 13. What type of fracture occurs after a Fuchs injury with dorsal dislocation of the radius? A. Smith's fracture. B. Bennett's fracture. C. Colles fracture. D. Galeazzi fracture. Question 14. How can a therapist test for suspected ulnar abutment? A. Press test. B. Gripping rotary impaction test. C. Ulnar compression test. D. Shuck test. Last but not least, question 15. Wrist instability between the scaphoid and lunate is an example of A. Carpal instability dissociative. B. Carpal instability non-dissociative. C. Carpal instability complex. D. Carpal instability adaptive. All right, all done. Amazing job, everybody. Congratulations, you made it to the end of the 15 questions. Take a moment, pause the video here, go back if you need to go back through the questions or go back through your answers. Make sure that you feel committed to them, and then let's go ahead and go through the answers and a brief rationale for why this is the best choice of the options. Question 2, the answer is B, Kienbock's disease. That is the avascular necrosis of the lunate. Preiser's disease is avascular necrosis of the scaphoid. A slack wrist is a scapholunate advanced collapse, which is common with arthritis. And then perilunate dislocation is dislocation of the carpus relative to the lunate. The answer for question 1 is A, the central slip. So when the central slip is cut or damaged, it will cause the lateral band to slip volarly, and that forces the PIP joint into flexion, which over time will force the DIP to hyperextend. The answer muscle, correct answer is D, the anterior interosseous nerve. If this was a challenging question, I would recommend looking back at the potential compression sites for each nerve of the upper extremity. Question 4. So with this question, I would say you're looking for the best answer of all the other options. The correct answer in my mind is B. Due to the bony congruency and dynamic and static stabilizers, the elbows are very stable and they get stiff very quickly. And in this case, we know there's a good quality of repair with adequate stability. So I would prefer typically to start 3 to 5 days to allow for post-op swelling to get more under control. But of all of these answers, the earlier the better. So that 1 to 2 days after surgery is the best possible choice here. Question 5, the correct answer is C, Yergeson's test. The drop arm sign is for the rotator cuff. Neer's test is for impingement, which you would want to then further distinguish between supraspinatus or long head of the biceps of that subacromial impingement. And then the external rotation lag sign is again for the rotator cuff or the supra and infraspinatus. Question 6, the correct answer here is C. You would want to limit that overhead reaching and full end active range of motion in that first couple of weeks after surgery. For question 7, the correct answer is A, a VY advancement flap. That will help to preserve length for the fingertip to be able to pinch, preserve that pinching function. Question 8, correct answer is A, pedicle flap. Local flaps include the Moberg advancement or VY advancement. The free tissue transfer is a larger area of tissue being transferred, like from the groin or scapula or lateral arm. And then a skin graft is not considered a flap, it's something separate. Question 9, the correct answer is C, Wartenberg syndrome or wristband syndrome or watchband syndrome. This is all about knowing your anatomy and where those potential compression sites are, and where the watch band would lie is right over that sensory branch of the radial nerve. Question 10, correct answer C, the ligament of Struthers is not a potential soft tissue site for compression of the ulnar nerve. That is a little bit of a tricky question. The arcade of Struthers is for ulnar nerve compression site. The ligament of Struthers is a median nerve compression site, which is rare. The answer for question 11 is B. The mechanics of the collateral ligaments at the MCP joint is that they are going to be taut in flexion and slack in extension. So that's why typically you'll immobilize MCP joints in some amount of flexion for stability. Question 12, correct answer is A. The lunate will flex. So in a VC instability pattern, the lunotriquetral ligament is injured, which causes the triquetrum to extend and the scaphoid to flex. The lunate is going to follow whichever bond is unbroken. So when I learned about this from ASHT hand therapy review course, they had 3 people stand up, and one person was the scaphoid, one was the lunate, and then the third person was the triquetrum, and they all held hands, and then we practiced kind of the difference between VZ and DZ and what will happen when those bonds are unbroken. So that helped me to visualize it. Correct answer for question 13 is C, a Colles fracture. Smith's is the reverse of a Colles, so it's a palmar dislocation of the radius. Bennett's is a thumb fracture at the first metacarpal base, and then a Galeazzi fracture is the fracture of the middle to distal third of the radius with a Druge subluxation or dislocation. Question 14, correct answer here is B, the grit test. The press test is for testing TFCC injuries. Ulnar compression is for an ulnar nerve compression at Guillen's Canal. And the Shuck test is a LT ballottement test. Correct answer for the last question, question 15, is A CID. That is an injury between the same row, pieces of the same row of carpals. The CIND is between the proximal and distal carpal rows. A CIC has both CID and CIND components. And then the CIA is something outside of the wrist causing carpal malalignment. That is it. Amazing job, everybody. Hopefully that was helpful in some way. If you have any questions or videos that you'd like to see in the future, please comment below. Give this video a thumbs up if you enjoyed it, and subscribe to the channel so you never miss another hand therapy video again. And have a wonderful day, and thank you so much for watching.